We're all getting older, but most men don't like the idea of looking and feeling older than we need to. Wouldn't it be nice if there was a safe and effective method for maintaining physical and mental vitality well into our senior years? Thankfully, there is. For many men, testosterone replacement therapy provides a natural option for feeling more youthful and energetic as we age. George is tired. He can't think of any particular reason that he would feel this way, but since turning 45, he's noticed that his energy levels seem to be declining with each passing year. It's not just his energy. Lately, George has noticed that it is more difficult to keep from gaining weight. Some days, it's harder to concentrate, and he gets irritable easily. And though he hates to admit it, his sex drive is much lower than it used to be. George just wants to feel better. He knows he is still a relatively young man, but he is worried about how old he feels all the time. On the advice of a friend, George went to see an anti-aging specialist, a doctor who uses the latest medical therapies to help people maintain good health as they age. After a medical exam and a couple of simple lab tests, the anti-aging doctor told George that he was suffering from low testosterone, a relatively common problem in middle-aged men. The doctor explained that testosterone is a powerful hormone produced in the reproductive organs of men. He said that in men, testosterone is important for the development of reproductive tissue, like the testes and prostate. Also, it is responsible for all of the things we normally associate with being male, such as increased muscle mass, bone density, body hair growth, distribution of fat, and male libido or sex drive. After age 30, testosterone levels slowly decline, and as this occurs, some men experience loss of muscle strength, an increase in body fat, a decrease in bone density, and a reduction in sex drive. According to the doctor, each man has an ideal level of testosterone where he feels best. Too much testosterone can be just as uncomfortable as too little. After listening to his doctor's explanation, George decided to try hormone replacement therapy to optimize his testosterone levels. He understood that he would have to have some preliminary tests to check his heart, prostate, and red blood cells, and then he would need periodic tests to make sure the therapy was working properly. After a few short weeks of replacement therapy, George noticed he was feeling much better. His energy levels were returning to normal, and his mood and concentration had improved dramatically. Now, George has the energy to exercise regularly and, with the help of a healthy diet, has lost weight. He is also enjoying a rediscovered intimacy in his relationship that he is very pleased about. George knows that, like everyone, he is getting older. But now, with a healthy lifestyle and optimized hormone levels, he's confident that he is doing everything he can to stay strong, active, and energetic for many years into the future.